Every day, you go through the same hygiene routine, washing your hands, brushing your teeth, taking a shower, changing your clothes. You've been doing it for years, following the habits you were taught, believing they are keeping you clean and healthy. But what if I told you that some of these habits might actually be harming you? The truth is, many common hygiene practices aren't as safe or beneficial as you think. Some can weaken your immune system, others can lead to infections, skin damage, or even more serious health issues over time. And the worst part? Most people don't even realize they're making these mistakes until it's too late. You might think that hygiene is all about keeping bacteria away, but the human body is far more complex. Overcleaning can be just as dangerous as undercleaning. Certain products can cause more harm than good. And small mistakes, repeated daily, can add up to serious health consequences. In this video, we're exposing 7 hygiene mistakes that could be secretly damaging your health. And, more importantly, how to fix them before they start affecting your well-being. If you want to protect your health and avoid these hidden dangers, hit like and subscribe. Because what you don't know can hurt you. You wash your hands, use antibacterial soap, wipe down every surface with disinfectant, and keep a bottle of hand sanitizer close at all times. It feels like the right thing to do. After all, bacteria and viruses are everywhere, and staying clean means staying healthy, right? But what if I told you that your efforts to protect yourself might actually be doing more harm than good? Over the last few decades, antibacterial products have flooded the market. From soaps and body washes to cleaning sprays and sanitizing wipes, companies have convinced people that the more we eliminate bacteria, the healthier we'll be. But the human body isn't designed to live in a sterile environment. In fact, constantly killing bacteria, including the good ones, can weaken your immune system, disrupt your skin's natural defenses, and make you more susceptible to illness in the long run. Your body is home to trillions of bacteria, and not all of them are harmful. In fact, many of them are essential for keeping you healthy. Your skin, gut, and respiratory system all rely on a delicate balance of bacteria to function properly. When you overuse antibacterial products, you strip away not only the bad bacteria, but also the beneficial ones that help regulate your immune system, fight infections naturally, and keep your skin barrier strong. One of the biggest dangers of excessive antibacterial use is immune system weakening. Your immune system is like a muscle. It needs exposure to different bacteria to stay strong. When you constantly eliminate all germs from your environment, your immune system doesn't get the practice it needs to fight off infections. Over time, this can make you more prone to getting sick, not less. Then there's the issue of antibiotic resistance. Overuse of antibacterial products, especially those containing ingredients like triclosan, has contributed to the rise of drug-resistant bacteria. These so-called superbugs are becoming harder to treat with antibiotics because they've adapted to survive even the strongest antibacterial agents. Ironically, by trying to eliminate bacteria, we've helped create stronger, more dangerous ones. But it's not just about immunity. Your skin suffers too. Your skin has its own microbiome, a layer of bacteria that acts as a natural barrier against infections, irritants, and environmental damage. When you strip your skin of these good bacteria by overusing antibacterial soaps and hand sanitizers, your skin becomes more prone to dryness, irritation, and even conditions like eczema and dermatitis. So what's the solution? Balance. Proper hygiene is important, but it doesn't mean eliminating all bacteria from your life. The key is to clean effectively without overdoing it. First, reserve antibacterial soaps and hand sanitizers for situations where they're actually needed, like after using public transportation, handling raw meat, or being in contact with someone who is sick. For daily hand washing, regular soap and water are just as effective at removing dirt and bacteria without disrupting your skin's natural defenses. Second, avoid antibacterial body washes and harsh disinfectants on your skin. Instead, opt for gentle cleansers that clean without stripping away essential bacteria. Your skin's microbiome is a crucial part of your immune defense, and constantly disrupting it can make your skin more vulnerable to infections and irritation. And lastly, let your immune system do its job. Exposure to a variety of bacteria, especially in natural environments like parks, gardens, and even interacting with pets helps train your immune system to recognize and fight off harmful pathogens. Living in an ultra-sterile environment doesn't make you healthier. It makes you more vulnerable. Hygiene isn't about killing every germ. It's about maintaining a healthy balance. Your body was designed to coexist with bacteria, not to eliminate them entirely. So the next time you reach for an antibacterial wipe, ask yourself, is this necessary? Or am I weakening my body's natural defenses without realizing it? If this was an eye-opener for you, don't forget to like and subscribe, because understanding how your daily habits impact your health is the first step to living a stronger, healthier life. You step out of the shower, feeling fresh and clean. Reach for your towel and wrap it around yourself without a second thought. Later that night, you slip into bed, nestling into your pillow, enjoying the softness of your sheets. But what if I told you that these everyday comforts might be hiding something you'd rather not think about? Towels and bedding, two things we use every single day, often without considering how clean they really are. And that's exactly the problem. Most people don't change them as often as they should, unknowingly creating the perfect environment for bacteria, fungi, dust mites, and even mold to thrive. Your towel, for example, might seem clean because you only use it after showering. But think about it. You're rubbing it all over your body, over and over again, trapping moisture in the fabric. Damp, warm, and full of dead skin cells, your towel quickly becomes a breeding ground for bacteria. If you're using the same towel for a week or more without washing it, you're essentially drying yourself off with a cloth covered in germs. Bedding is no different. Your sheets, pillowcases, and blankets absorb sweat, body oils, and dead skin cells every single night. And let's not forget about dust mites, microscopic creatures that feed on dead skin and multiply in your mattress and pillows. The longer you go without washing your bedding, the more you expose yourself to potential allergens, breakouts, and even respiratory issues. So how often should you be washing these essentials? Towels should be washed every 3 to 4 uses, ideally more often if they stay damp for long periods. Hand towels and washcloths should be washed even more frequently, as they accumulate bacteria at a faster rate. As for bedding, pillowcases should be changed at least once a week, while sheets and duvet covers should be washed every 1 to 2 weeks. If you sweat a lot at night or have allergies, washing them more frequently can make a huge difference in your overall health. And don't forget about pillows and mattresses. Pillows should be washed or replaced every 6 months to a year, as they accumulate dust mites, bacteria, and even mold over time. Mattresses should be vacuumed regularly and protected with a washable cover to minimize allergen buildup. You might be thinking, I've been using the same towel and sleeping in the same sheets for longer than I'd like to admit, and I feel fine. But that's the thing. The effects of poor hygiene habits don't always show up immediately. Over time, exposure to bacteria and allergens can lead to skin irritation, acne, respiratory issues, and even an increased risk of infections. Making these small changes doesn't just keep you clean, it helps protect your skin, your health, and your overall well-being. A fresh towel and clean sheets don't just feel good, they're an essential part of maintaining hygiene and preventing unnecessary health problems. So, let me ask you, when was the last time you changed your towels and bedding? Be honest and drop a comment below. I won't judge. Brushing your teeth is something you've done thousands of times in your life. It's such a routine part of the day that you probably don't even think about it anymore. But what if I told you that the way you brush your teeth might actually be harming your gums and teeth rather than protecting them? Most people assume that as long as they're brushing twice a day, they're doing everything right. But the truth is, many common brushing habits can actually lead to gum recession, enamel erosion, and an increased risk of cavities, even if you never skip a brushing session. One of the biggest mistakes? Brushing too hard. You might think that scrubbing your teeth with more pressure will make them cleaner, but the reality is that aggressive brushing wears down your enamel and damages your gums. Over time, this can lead to gum recession, exposing the sensitive roots of your teeth, which can cause pain and make you more vulnerable to decay. Your toothbrush should clean your teeth, not scrape them. Then there's the issue of using the wrong toothbrush. If your bristles are stiff and hard, you might think they're doing a better job of removing plaque, but they're actually more likely to cause gum irritation and micro damage to your enamel. Soft bristled toothbrushes are far more effective at cleaning your teeth without causing unnecessary harm. Another common mistake: not brushing long enough. Most people don't actually brush for the recommended 2 full minutes. If you're just running your toothbrush over your teeth for 30 seconds and calling it a day, you're missing out on a deeper clean that helps prevent cavities and gum disease. The best way to make sure you're brushing long enough? Set a timer or use an electric toothbrush with a built-in timer to guide you. And let's talk about technique. Brushing back and forth in a harsh scrubbing motion isn't the best way to clean your teeth. The proper method involves gentle, circular motions, angling your brush at 45 degrees toward the gum line to remove plaque without causing damage. If you've been brushing the wrong way for years, it's not too late to retrain yourself and protect your oral health. Another mistake: brushing immediately after eating acidic foods or drinks. If you just had coffee, orange juice, or anything high in acid, your enamel is temporarily softened, and brushing right away can actually wear it down faster. Instead, wait about 30 minutes before brushing, or rinse your mouth with water to help neutralize the acid. And let's not forget about the importance of brushing your tongue. Bacteria don't just live on your teeth, they also thrive on your tongue, leading to bad breath and an increased risk of plaque buildup. If you're skipping your tongue while brushing, you're leaving behind a major source of bacteria in your mouth. Then there's the issue of not replacing your toothbrush often enough. If your toothbrush bristles are frayed or worn out, they aren't cleaning your teeth effectively anymore. You should replace your toothbrush every 3 months, or sooner if the bristles start to lose their shape. And finally, skipping flossing is one of the biggest mistakes people make. Brushing alone only cleans about 60% of your tooth surfaces. Flossing is the only way to remove plaque and food particles from between your teeth, where cavities and gum disease often start. If flossing feels like a hassle, try using floss picks or a water flosser to make the process easier. Brushing your teeth is something you'll do for the rest of your life, so why not make sure you're doing it the right way? Small changes in your brushing habits can mean the difference between strong, healthy teeth and years of preventable dental problems. If this was an eye-opener for you, take a second to like and subscribe, because better habits start with the right information, and your smile deserves the best care possible. You take care of your hands, your face, and your teeth, but how often do you really think about your feet? For most people, foot hygiene is an afterthought, something they pay attention to only when there's a problem. But ignoring foot care can lead to serious health issues, from chronic infections to mobility problems that affect your overall well-being. Your feet carry you through life, yet they're often the most neglected part of the body. Every day, your feet are exposed to sweat, bacteria, and pressure that can cause long-term damage if left unchecked. Wearing the wrong shoes, failing to keep your feet dry, or skipping basic foot hygiene can create the perfect environment for fungal infections, skin issues, and even nerve damage. The worst part? Many foot-related problems develop gradually, meaning you might not notice the damage until it's too late. One of the most common consequences of neglecting foot hygiene is fungal infections. Athlete's foot, toenail fungus, and bacterial infections thrive in warm, damp environments, like inside your shoes. If you don't wash and dry your feet properly, bacteria and fungi can multiply, leading to itchy, cracked skin, thickened nails, and even painful swelling. And if left untreated, these infections can spread, becoming harder to eliminate over time. Then there's the issue of calluses and cracked heels. Many people assume that dry, rough feet are just a cosmetic issue, but untreated calluses can lead to painful fissures that make walking uncomfortable. Cracked skin on the heels can even become an entry point for bacteria, increasing the risk of infection. Poor foot hygiene doesn't just affect the skin, it can also impact your circulation and overall foot health. Wearing tight shoes, standing for long hours without proper support, and failing to stretch your feet can lead to conditions like plantar fasciitis, bunions, and chronic foot pain. Over time, these issues can make walking difficult, affecting your posture and even leading to knee, hip, and back problems. So how do you take care of your feet properly? It starts with daily habits. Washing your feet with soap and water, not just letting water run over them in the shower, is essential to remove sweat and bacteria. Drying them thoroughly, especially between the toes, prevents fungal infections from taking hold. Moisturizing is another key step. If your feet are dry and cracked, using a foot cream can help restore moisture and prevent painful fissures. But be careful. Applying lotion between your toes can actually trap moisture and encourage fungal growth. So focus on the tops and bottoms of your feet. And let's talk about shoes. Wearing breathable, properly fitted shoes can prevent a host of foot problems. Tight shoes restrict circulation, leading to numbness and swelling, while shoes without proper support can cause long-term damage to your arches and joints. Rotating your shoes, wearing moisture-wicking socks, and letting your feet breathe when possible can make a huge difference in foot health. Regular foot inspections are just as important. Checking for blisters, cuts, or signs of infection can help catch problems early before they turn into something more serious. If you notice persistent pain, swelling, or discoloration, it's crucial to address it rather than ignoring it until it worsens. Foot health isn't just about avoiding discomfort. It's about maintaining your mobility and independence as you age. Your feet are the foundation of your body, and taking care of them means taking care of your overall well-being. If you've ever had foot issues or have tips for keeping feet healthy, I'd love to hear from you. Drop a comment below and let's talk about the simple things we can do to keep our feet strong, healthy, and pain-free. You step out of the shower, grab a cotton swab, and instinctively reach for your ears. It's part of your routine. Cleaning out the wax, making sure your ears feel fresh and clear. But what if I told you that this simple habit could actually be putting your hearing at risk? Most people assume that earwax is something that needs to be removed regularly. We've been conditioned to believe that clean ears mean wax-free ears. But that's not entirely true. Your ears are self-cleaning. The wax inside your ear canal isn't just useless buildup. It serves a purpose. It acts as a natural barrier, trapping dust, dirt, and bacteria before they can reach the delicate structures deeper inside. When you aggressively try to remove it, you're not just clearing out debris. You're disrupting your body's natural defense system. One of the biggest mistakes people make is using cotton swabs. It might feel satisfying to scoop out earwax, but in reality, you're likely pushing more wax deeper into your ear canal, compacting it against your eardrum. Over time, this can lead to blockages, reduced hearing, and even painful infections. In some cases, excessive earwax buildup caused by improper cleaning can require medical removal by a doctor. And it's not just cotton swabs. Other common mistakes include using hairpins, toothpicks, or even ear candles. These methods aren't just ineffective, they can be downright dangerous. Puncturing the eardrum, causing inner ear infections, or burning the delicate skin inside the ear canal are real risks when using the wrong cleaning techniques. So how should you clean your ears safely? First, understand that most people don't need to clean their ears at all. Your body naturally pushes old wax outward, where it dries and flakes off on its own. If you notice excess wax near the outer part of your ear, simply wiping it away with a damp cloth is enough. For those who do produce more earwax than usual or feel discomfort, there are safer methods. Over-the-counter eardrops that soften wax, warm water rinses in the shower, or seeking professional cleaning from a doctor are the best options. Never attempt to remove deep wax buildup yourself. If your ears feel blocked or your hearing is affected, consult a medical professional instead of reaching for a cotton swab. Another thing to avoid: over-cleaning. Constantly removing wax can cause your body to produce even more as a response. This leads to a frustrating cycle where the more you clean, the more wax builds up, making you feel like your ears are constantly clogged. Ear hygiene is about balance. Your ears aren't meant to be completely wax-free, and trying to make them that way can do more harm than good. Instead of seeing earwax as a problem, start viewing it as what it is: a natural protective function of your body. If this information surprised you, take a moment to like and subscribe, because the habits you think are keeping you clean might actually be putting your health at risk. Your ears deserve better. and now you know how to take care of them the right way. You glance at your hands, noticing how dry they feel, how fine lines seem to have deepened overnight. Maybe your legs itch, your heels are cracked, or your face feels tight after washing it. You tell yourself it's nothing, that dry skin is just part of getting older. But what if ignoring it is actually causing more damage than you realize? Dry skin isn't just a cosmetic issue, it's a barrier problem. Your skin is your body's first line of defense, protecting you from bacteria, viruses, pollutants, and environmental damage. When that barrier is weakened due to lack of moisture, your skin becomes more vulnerable to irritation, infections, and even chronic conditions like eczema or dermatitis. The outermost layer of your skin acts like a protective shield, keeping harmful microorganisms out and locking hydration in. But as you age, your skin naturally produces less oil, making it harder to retain moisture. Without regular hydration, small cracks form in the skin's surface, allowing bacteria and allergens to penetrate more easily. This is why dry, neglected skin is more prone to infections, redness, and persistent irritation. And then there's the issue of premature aging. Dehydrated skin lacks elasticity, making wrinkles and fine lines more pronounced. Collagen, the protein responsible for keeping skin firm and youthful, breaks down faster in dry conditions. Over time, this accelerates the formation of deep-set wrinkles, making skin appear older than it actually is. But hydration isn't just about drinking more water. It's about sealing in moisture where your skin needs it most. Many people assume that using lotion occasionally is enough, but not all moisturizers are created equal. Some products contain ingredients that sit on top of the skin rather than penetrating deeply, giving the illusion of hydration without actually repairing the barrier. So what should you be looking for? Hyaluronic acid is a game changer for hydration as it attracts and holds water in the skin. Ceramides help restore the skin's natural barrier, preventing moisture loss. Glycerin, shea butter, and squalane are also excellent ingredients that deeply nourish and protect against dryness. If your moisturizer isn't locking in hydration, it's not doing its job. Skipping moisturizing doesn't just lead to dry skin, it can result in long-term damage that affects both appearance and health. Your skin needs daily care, just like any other part of your body. The difference between skin that ages gracefully and skin that looks dull, irritated, and fragile often comes down to one simple habit: consistent hydration. Because in the end, it's not just about looking good, it's about keeping your skin strong, resilient, and capable of protecting you for years to come.